going back about 15 years, I used to get bronchitis regular. And at the hospital they, at the end, diagnosed bronchiectasis. That means where your lungs stop functioning properly, and gradually the fluids in the lungs builds up. When my breathing became worse, realised that I couldn't walk as far, I couldn't do things which I'd taken for granted. They suggested that I go on oxygen at home. I use it more or less all the time, 24 hours a day. That's how you know that things are getting worse. When I get up, I feel fine, and then as soon as you take the blankets off you and you put your legs out of bed, that's when your oxygen levels shoot to all the parts that have just come into be in your legs, and it's really, really hard. Then from then you realise that you can't do things which you took for granted, going for walks. I used to run, I used to cycle, things like that. And that stops, but then it creeps in on you, and when you can do less things, you lose your confidence at first. You're frightened to go out because you know that it's going to be hard work. Well, the transplant list it's not a list as such where the time and then you go up the list. It's a case of matching the lungs. So, you know, everything, it's got your blood group, the weight, tissue, everything has got to be right. And they don't come that often. And there could be 4, 5, 10 people waiting for that same type of lung, and then again it's then like a lottery whether you're chosen, and there's a group of people that choose whose needs are the most. I mean, there's a lot of people, 30% of people waiting for transplants die on the list. 30%, that's how bad the case, the situation is. I could live as I am now for 5, 6, 7 years, maybe more, but quality of life will be zero, be nothing. And the difference is, by having lungs, even if I got just 5 years, the difference would be the quality of life. And that is the incentive. And that's what I think is why you keep going.